Good afternoon and welcome back to the Provider Lounge. We're at the American Healthcare Association Annual Convention. Today I have David Voepel from Illinois Healthcare. Thank you, David.
Thanks for having me.
He's the Executive Director of the association.
Mm-hmm.
Great.
Thanks for having me.
You're welcome.
Appreciate it.
We are talking to many people this week and we're really interested to know what's happening specifically in Illinois and what is keeping you and your members up at night.
If I could say it in a nutshell, it's lack of payment from different perspectives. And from that, we have 535 members that cross the gamut of continuum of care. So we have SNFs, we have DD providers, we have assisted living providers. All right, assisted living is not paid by Medicaid. However, the state has decided that we don't have a budget. They put together a stopgap budget, and it's for 6 months. Fortunately, nursing homes are paid through a court order, but yet we might not get paid for 4 or 5 months. So the problem with that is that, okay, you don't know when your cash is going to come in, and you still got to make payroll every week or every 2 weeks. So there's a big issue with that. Not only that, but then when you have a Medicaid applicant, they will come in and you do all the application process and everything else. You send it to the state of Illinois, they lose it, they forget it, they drop it. We call them pendings, Medicaid pendings, and they could be out for up to 2 years.
Okay, well, so you're telling me that your receivables could run you 6 months, and then your pendings could run up to 2 years. Well, you can't operate in that environment. Cash is king, right? How do you operate?
So you have somebody in your facility for 2 years, they're on your dime because the state hasn't agreed to go with Medicaid on this. Same issue with that Kansas had. That Good Sam in Kansas brought that whole lawsuit around, and we're looking at doing that same thing in Illinois because it's just ridiculous. And CMS has this nice little rule that they conform to, and we have a law with the American Disabilities Act. It's been around for 20 or 30 years now, whatever it is, 1990s. And they say providers are going to give us the best price. They're going to house the most frail folks in the nation, in our country. We demand that you pay states, it's federal law, within 45 days. And where's our state? They're out months, maybe 2 years. What the heck? We don't care. Yeah, so it's really hateful for our providers.
That's difficult. That's very difficult. And are you seeing shutdowns because of it?
You would think so.
Yep.
But these guys are, I don't know how they do it. I really don't. And well, I know one way that they do it. They're transitioning their instead of taking Medicaid, they're going to say, fine, we're not going to take Medicaid.
And
we'll concentrate on Medicare.
Rebranding, and they're looking at a different patient population.
Exactly.
And does that, what's your assisted living environment like?
It's just expanding like there's no tomorrow, because assisted living is not, we call it, we have a supportive living program, a SLIF program. That's Medicaid. There's only 65 SLIFs in the state of Illinois. The rest are all assisted living and they're all private pay. So, and they're just expanding. There's 6 of them. I'm from Springfield, a town of about 120,000. There's 6 going up right now that I can tell you about. Brand new facility. Who wouldn't want to go to them, right? So what happens to the SNF that's right there, whose occupancy is going down, and you have assisted livings that are coming up, and that's expanding. We're seeing this whole shift come around, and the state is sitting there with their sitting on their hands, not doing any payments or anything like that. But yet they want us to take care of the frail and the elderly, and yet they're not promoting any of this.
In the assisted living, you know, I've been researching assisted living for the last 5 years, and again, it is state specific.
Right.
So, for example, Massachusetts has a social model.
Right.
Other states have a medical model. What do you find that the patient population is primarily private?
Mainly private.
Mainly
for the
private?
most part, yeah.
And some states have a Medicaid funding for it, and some states do not.
Exactly.
But this shifting from the skilled nursing facility into the assisted living, there's a pros and cons to it.
Oh yeah.
Because the cons could be that the staff is not as well versed in the complexity of the senior population.
Exactly.
The pros are that it's a brand new facility and
Right.
it's gorgeous and it's has
It's like a 5-star hotel.
5-star hotel.
Yeah.
But the journey from the evolution is going to have to come down to cash flow, payment, and care.
Yes.
So it's very important to.
So again, we're seeing a shift, you know, and it's happening throughout our country to where assisted livings now are the nursing homes of yesteryear.
That's okay.
You know,
Yes.
so the acuity is going up, and not only in nursing homes, but the acuity is rising in assisted living. And whenever you get into programs, whether it's the state or the federal government, government's always 5 years behind on legislation. Whether it's technology or security or whatever the case might be, they're always so slow to react, and they're very reactionary, but something has to happen. So if you have a death in assisted living, you're going to see an explosion of regulations. You're going to see things happen in that area, and that's what we're here to protect. Not only the assisted living side, but also the SNF side.
That's great.
So
they need advocates like you.
They do.
You need to have, every state has their associations that are extremely relevant and required in order to represent all the organizations, all the healthcare, assisted living, SNFs, independent livings in the state.
We always tell people that it's a democracy. You can do whatever you want. Come to the State House, join us, whatever the case might be. But I'll promise you, you can't be in every meeting because you have a business to run. We have to be in every meeting.
That's right.
We have to be there at the state capitol or in Washington, D.C. I mean, with AHCA, they have to be there.
That's right.
So they have to advocate for it. And so that's huge. And that's part of the process that we use to get new members.
Well, David Voepel from Illinois Healthcare, thank you so much. Thank you for coming.
Thanks for having me.
Great information.
Appreciate it.
We're going to figure this out.